Welcome to the MAFEIP Introduction video series, a series designed to help you understand and use the monitoring and assessment framework of the European Innovation Partnership on Active and Healthy Aging, for short, the MAFEIP tool. In this session, you will continue to learn more about the model output step and how to interpret the other results given. Results from the first two sections, incremental costs and effects, and cost effectiveness, have been discussed in the previous video. In this video, we will continue to discuss the next sections, namely population impact and patient flow through model states. The results used in this section are outcomes from data that are based on the VPH Derrick case study, which can be found on the MAFEIP website. The section population impact shows a table and two graphs. The default population size value given here is taken from the overall population size value of the country that was selected in previous sections, in this case, the UK's. You can change the population number into that of your target group. Looking at the table, the population level impact on incremental cost value displayed here is simply the incremental cost value found in the previous cost effectiveness table, multiplied by the population number you specified. Similarly, the population level impact on incremental HRQOL value is the incremental effects value found in the previous cost effectiveness, multiplied by the population number. The two graphs show the incremental costs and effects per person accumulated over a time period. This time period represents the number of years a patient uses the intervention. The graph on cumulative incremental costs over model horizon depicts an initial downward curve, indicating that the costs decrease during approximately the first 20 years of intervention usage. After this, the costs remain stable, but still lower than the value at the beginning. This graph is to be interpreted in a positive manner, as the intervention is shown to accumulate savings, indicated by the negative value, rather than excess spendings. The second graph shows an increase in cumulative quality adjusted life years, or QALYs, gained per patient throughout 45 years of intervention usage. This is also to be interpreted positively, as it points to a general increase in QALYs gained even with longer usage of the intervention. The last section, patient flow through model states, displays two graphs. Both graphs illustrate the probability that a patient would stay in a particular health state when using the intervention or standard care. It aims to help the user better understand the transition probabilities that are used in the model simulation. The first graph depicts the probability of each given age group to stay in either the baseline health state or the deteriorated when using the intervention or standard care. The second graph shows the probability of a patient to die while using the intervention or using standard care, according to given age groups. It can be seen from this graph that the higher the age of the patient, the higher the probability to die. It can also be seen that the two plots run along the same path. This means that whether the patient is using the intervention or not, there is the same probability of dying. This could then be interpreted as a probability of dying being more age-dependent than intervention-dependent. This video presented the MAFEIP tool output model step and how to interpret the results given. Would you like to try out MAFEIP? Contact us at info@mafeip.eu to get assistance and more information. Also, be sure to check out the other videos in this MAFEIP Introduction video series. Thank you for watching